Tuberculosis is still a silent killer in Malaysia, with many patients seeking treatment only after the disease has permanently damaged their lungs and increased their risk of mortality. Former Institute of Respiratory Medicine Director Dato Dr. Abdul Razak Potalif advised patients exhibiting symptoms of TB, especially those considered at higher risk to contract the disease, to go for an X-ray screening to detect it early. He says TB is curable, but it's difficult to control when patients seek treatment late.
The one thing you must know that TB, like I say, is 100% curable. But then the patient must come early. If they come late, the lungs are damaged, then the TB germs can die, but not the lungs. Lungs can never improve. That's why they die. So if they got very bad lung damage, then the lung damage is already there, it's permanent. But the germs will die.
Patients can seek treatment for TB at any government clinics to get treated.
So if you ask me, in this region, you can say that Malaysia, the government has the best TB control program because we've got a good healthcare system. In a sense that TB is 100% free for treatment in the government. You don't have to pay a single cent. And again, TB again can be treated anywhere in Malaysia. Like say in my institute, if I see a TB patient and the person is staying in Kepong, you don't have to come here for TB treatment every day. You can go to the nearest clinic kesihatan and get the same drug. So in that sense, the TB can be treated wherever the patient is staying. That's why they say decentralized. So in that sense, our healthcare system in Malaysia is very good for TB.
Individuals who are at a higher risk to contract TB, such as smokers, the elderly, and those with diabetes or HIV, a minor cough could be a sign of a bigger problem.